In this video, we'll discuss about gastric cancer. This gastric cancer is the sixth most common cancer and fourth most common cause of cancer related death worldwide. So, sixth most common cancer and fourth most common causes of cancer related death. Risk factors that age mainly 70 years age group people mainly affected. Sex 2:1 ratio, male 2 percentage, female 1 percentage. Then because of that H. pylori infection 60 percentage of cases. Then smoking and alcohol, obesity, a diet with pickled or processed food. Then family history. This one family history 10 percentage cases. In this 1 percentage cases because of autosomal dominant. So autosomal recessive disorder. In this one because of defective gene CDH1 coding for E. Catherine, that genome defect, so it will causes this gastric cancer. Then pernicious anemia, gastritis, most common cancer commonly this one commonly seen in Central and South America, China, Japan, Korea and Europe. So what are the risk factor? That median age 70-year age group of people and comparing to female male 2 percentage. Then because of bacterium helicobacter, smoking, alcohol, obesity. Then diet with pickled or processed food. Then family history. In this 1 percentage because of genetic disorder, defective of gene CDH1 coding for E. Catherine genome. Then pernicious anemia and gastritis. 95% of gastric cancer is adenocarcinoma, 5% lymphoma, carcinoid, stromal tumor. So, in gastric cancer, 95% because of adenocarcinoma, 5% because of lymphoma, carcinoid, stromal tumor. Mainly this lower part most commonly affected. So, most common site lower part pyloric antrum followed by laser curvature, this part. Then cardia, then fundus and body. So common location that pyloric antrum followed by laser curvature, cardia, fundus and body. Gastric cancer can be asymptomatic. The maximum of the time this one don't producing any symptoms, asymptomatic or non-specific, but often diagnosed at this one is the latest stage. In this one what are the sign and symptoms? Latest stage only we can find out. Maximum 4 stages, third stage only we can find out. Weight loss, then dysphagia, then indigestion and heartburn, then fatigue, bloating, nausea or vomiting. Then symptoms bleeding will happen, hematemesis, blood in vomit, melena condition or anemia. Then difficulty for swallowing, dysphagia. These are the symptoms. Then what are the diagnosis? By using endoscopy we can visualize the stomach. Then biopsy are the golden method. Then imaging technique by using CT scan. We can observe that, evaluate surrounding tissue whether that can spread surrounding tissue or not. By using CT scan we can observe. Then here staging, TNM staging system. T stand for tumor, N stand for nodules, then metastasis. T primary tumor only local inversion, N lymph node involvement. M. Distant metastasis. So stage 0 to 4, this one, stage 0 cancer is limited to epithelium. Okay, so tumor carcinoma in situ. So here limited only. 2, 1, 2, 3 only deeper infiltration, then only lymph node involvement. Most stomach cancer seen in stage 3 only, then stage 4 only it will affected distant part, distant metastasis. Then diagnosis, western population, that is a 5-year survival timing. Western population 30 percentage survival time 5 years. Then part of that Asia, Japan and Korea 45 percentage 5-year survival plan. In early stage, stage 0 or 1, we diagnosed means 90 percentage survival. Third, fourth month only, that survival time will decreasing. Last one is treatment preventive method. In diet, we want to take rich amount of fruits and vegetables, and that fiber rich food material. Then risk factor control, that H. pylori, and that bacterium we want to eradicate. Then endoscopic mucosal resection we can find in that early stage. Then later stage means we can record partial or total gastrectomy, that means removal of stomach. After that, after surgery we want to follow chemotherapy. In the case of before surgery, we want to give adjuvant or neoadjuvant because it will shrink the tumor. Then immunotherapy we can use trastuzumab. Trastuzumab, that means growth promoting protein. This one is the growth promoting protein, it will increasing survival time of that patient. Then nivolumab, increasing anti-tumor activity. These drugs having increasing anti-tumor activity. So in this video we discussed gastric cancer, 6th most common cancer. These are the risk factors. Then 95% because of adenocarcinoma, 5% because of lymphoma, carcinoid stromal tumor. Then common site, pyloric antrum is the most common site. Third stage only we can find out that symptoms, bleeding, dysphagia. Diagnosis, endoscopic method, biopsy method, CT scan. Survival timing, stage 0-1 diagnosed means 90% survival. Treatment, in diet we want to take fruits and vegetables. Nivolumab, increasing tumor activity. This is the growth promoting protein, increasing survival time. Trastuzumab, growth promoting protein, increasing survival time. Thanks for watching.